Let's now look at some commonly asked questions pertaining to total knee replacement. When can I stop using the walker, crutches, or cane? Well, of course this varies, but on average you may use the walker for 2 to 3 weeks. You can then change to using a cane when you feel stable, have sufficient strength, and good balance. If you're unsure, wait to talk to your doctor. When you use a cane, it should always be in your opposite hand. Can I refill my pain medications? Normally we'll give you a refill for approximately 4 to 6 weeks. However, most patients discontinue these after a few weeks. Remember that while you're on narcotic pain medications, you should not drive or operate any machinery. Will I become addicted to these narcotics? It's unlikely given this short-term use, but you should also be aware of the side effects, which include nausea, constipation, and itching. Use these medications only as needed. How does this all affect my sleep? Sleep difficulties are normal. That's because of the effects of surgery on your body, the pain from surgery, and the medications you're taking. You should return to a normal sleep cycle a few weeks after surgery. What about my appetite? A loss of appetite is a normal effect of surgery and the medications you're taking. What about driving? Check with your doctor, but usually you can resume driving after 6 weeks. This also applies even if you had your left or non-driving leg operated on. In addition, the narcotic pain medications will also impair your ability to drive safely. Will there be any swelling? It's normal to have some swelling in the leg you had surgery on. The swelling slows return of the fluid from the vein in your leg. If you develop painful swelling in your calf or thigh, this could be a deep vein thrombosis or blood clot. This, however, is rare while you're on blood thinners. What can I do to help control the swelling in my leg? You can relieve the swelling by elevating your leg several times a day. You can also relieve the swelling with ice and by wrapping the leg with an ACE bandage or a compression stocking. When is swelling in my leg not normal? If you develop swelling in both legs, you may be retaining fluid. If this doesn't improve with elevation or you develop pain in your calf, contact your doctor. Can I lay on my side? You can do this as soon as you feel comfortable. However, you need to remember to work on keeping your legs straight as possible for the first 6 weeks. This is difficult to do when sleeping on your side. That's why you should sleep on your back. How long will I have to go to physical therapy? Normally you'll need physical therapy 2 to 3 times per week for 3 to 4 weeks. This is the most important time after surgery because it usually determines its success. You must also do these exercises at home on your own. It's normal to have pain while doing your therapy. Use pain pills so you can perform your therapy well. Why is my knee warm and swollen? It's a normal part of the healing process for your knee to swell and feel warm, particularly after therapy. The swelling slows return of the fluid from the vein in your leg. Can I resume sexual intercourse? As soon as you feel you can do so safely. Do I need to continue on the blood thinners when I go home? You'll need to take a blood thinner to prevent clotting. Your surgeon has selected the product that works best for you. You'll take the blood thinner for 3 to 4 weeks. When can I shower or bathe? Normally you can shower within 3 days of surgery. Gently pat dry the incision with a clean towel. But do not take a bath or swim in a pool until the incision is completely healed, which normally takes at least 4 weeks. How do I care for my incision? Keep it clean, dry, and open to the air. You may have paper stera strips covering the incision stuck with a special skin adhesive. If you have these strips, they'll usually fall off on their own in a few weeks. Can I ride a bike? You can do that whenever you feel you can safely do so. Can I travel? You should wait at least 6 weeks before going long distances unless you ask your doctor for clearance. When you do travel, stop frequently, every hour or so, to prevent problems such as a blood clot. Can I golf? Yes, as soon as you can do so safely without falling or getting hurt. but because of the uneven terrain in most golf courses, you may want to wait at least 6 weeks. What about going to the dentist? Try to have any dental work before your surgery. Otherwise, wait 3 months unless it's an urgent need, such as with an abscessed tooth. You'll receive information about antibiotics for dental work from your surgeon's nurse. Will my new knee set off the alarm at the airport? That depends on the sensitivity of the machine. Your doctor will give you a laminated card stating you have a metallic orthopedic implant. If you forget your card, allow the officers to wave the security wand over your knee. How much physical activity can I do after surgery? Your joint replacement will last longer when curtailing extra stress. You should never run, jump, or do heavy lifting. Permanent work restrictions include no repetitive lifting more than 40 pounds. You may bend, kneel, and climb only after discussing this with your physician. What about sports? You can do sports such as golf, doubles tennis, and cross-country diagonal skiing. Avoid downhill skiing, running, basketball, softball, and singles tennis. If you're not sure, talk with your doctor. Is it normal to feel weak after surgery? You may feel tired and weak after surgery. This is from blood loss during surgery. Some of the medications you're taking may also make you feel weak and tired. If you're concerned, or you develop shortness of breath, dizziness, or chest discomfort, call your local emergency number. At Marshfield Clinic, we want to make your procedure as comfortable for you as possible. Thank you for choosing to have this procedure at Marshfield Clinic. If you have any questions at any time, please don't hesitate to call us.